Okay, I'm sitting here in my office looking at two health care bills. One is the Democrat version, just come out. It's 1,990 pages. This is it. It's printed on both sides, as you can see, to save paper. This is the Republican bill. It's also printed on both sides, and it's 219 pages. Now, you'd think that there's 10 times more good stuff in this one because it's 10 times bigger. But it's actually more than 10 times worse. I mean, this bill is about freedom. This bill is about bigger government, more intrusion. They say this bill cost $1.2 trillion to cover the uninsured. Now, we were told originally there was 48 million uninsured, and then when the president spoke to us about this, it went down to 30 million insured. We finally figured out they were trying to take the illegal immigrants out of this bill, health care coverage for the illegal immigrants out of this bill. But they're still in here, at least 2.5 million of them. So some of them are still in here. It actually only brings 6 million new people into the health care. It only insures 6 million new people. So we're going to spend $1.2 trillion, take over the system, raise taxes, limit choices, create a new bureaucracy. In fact, we're creating 118 new bureaucracies. We're going to have a healthcare czar. And how many jobs does this create? You see, we kind of forget that for every one of the jobs that we create in these 118 new bureaucracies, it takes 5 private sector jobs to pay for every one employee here. Well, this doesn't talk about creating any new jobs. It taxes small employers and drives up their costs, therefore they can't do business here, and forces jobs overseas. Now, this actually saves us money. The Republican version actually saves us money. This will help create jobs. We become more competitive. And why does it do that? Because we work on lowering the cost in the health care bill here. I mean, we look at tort reform, we look at defensive medicine, which is 10% of the costs. So we're going to reduce defensive medicine costs. We're going to cut the regulations. And the Kansas Hospital Association tells me that for every hour of health care, there's 1.1 hours of paperwork. Well, you can see why. Here's what the Democrats want to do with the bureaucracy. There'll be more paperwork than this. I mean, by the time they get done writing the regulations, it won't be 2,000 pages. It'll be 100,000 pages. I mean, good grief, they got 118 new bureaucracies that'll have to do something. They'll have to do something, so they'll sit around and they'll write regulations. That's what they always do. You hire a government employee, they got to do something, they write regulations. Regulations slow down the economy and certainly will slow down healthcare. If you have a pre-existing condition, it's covered in the Republican bill. You'll have access to a physician. There will be higher pools. There will be pools where your employer won't have to pay all the cost. It will be able to absorb some of the cost and help you out. If you live a healthy lifestyle, you'll be rewarded. You can get a health savings account here and save for future needs and actually lower your premiums over years instead of having them go up. There's a lot of good stuff in this bill. There's tax provisions, there's regulatory reform, there's associations that allows you to shop across state lines. I mean, it really does bring down costs for health care. And I think that's what we want. The Democrat health care plan, it's a government takeover of the health care system. Everything is to channel you into a government plan, either through Medicaid or Medicare. And while we're talking about Medicare, it takes away $500 billion over the next 10 years away from Medicare, something that's already funded. I mean, this is going to lead to rationed health care for seniors and for us. It has a bunch of sections here that aren't really priced yet. On top of the $1.2 trillion, trillion with a T, it has a phrase in here multiple times called such sums as may be necessary. What does that mean? That means that they haven't priced it yet. Things like the wellness program grants. Well, how much is that going to be for wellness program grants? Well, we don't know yet. How about the assistance to compacting states? Such sums as required. We don't know what that is. I mean, there's a whole list of things here, 28 different programs that we haven't priced yet. So the price is going up, freedom's going down. Here, the price goes down, freedom goes up. My choice is the Republican plan because it listens to the American people. You know, we had healthcare town hall meetings all across the United States. I had probably about 20 in Kansas alone, all over the state, and I heard a very clear message. Number one, people want to be able to choose their doctor. They don't want some government bureaucrat telling them where to go to get their health care. Number two, when you got a pre-existing condition, you want to be able to get insurance. So we put that in the bill. They think the price of health care is too high. So we worked on lowering the cost by addressing the cost centers. I mean, the people of America wanted tort reform. They wanted us to address these cost centers. They wanted it more accessible. They wanted more choices in health care. We provided that in the Republican plan, and it only took us 219 pages to do it. Now, taking away people's freedom is a little more difficult in America. So it took more pages to do it. 1,990 some pages. What was it? 1,990 pages, plus all the bureaucratic paperwork on top of it. There's a very clear choice for me, and I think a very clear choice for the American people.